New nurses. Cardiac assessment is more than just auscultating heart sounds. It's about determining your heart's ability to maintain circulation and perfusion. Hey, my name is Nurse Key, and welcome to the New Nurse Boot Camp, where I take this thing out of being a new nurse. So let's get into cardiac assessment. So of course, we're going to monitor the heart rate and the blood pressure. We're going to look at pulses, whether it's the radial, brachial, or femoral pulses. Those are the most common. You're going to see if it's regular, which would be +2. Is it weak or thready, or is it bounding? Bounding means I barely have to apply pressure to the artery and I can feel the pulse. Regular would be apply moderate pressure, like standard, and then weak is like I kind of have to force it and it's still not consistent. With the pulse, side note, with rhythms like AFib, you will have like sometime an inconsistent pulse that could be palpated. All right, so also with cardiac assessment, you're going to look at the skin. Is it like flushed? Is it within normal limits, pink? Is it the temperature warm, cold, or diaphoretic? You're going to listen to the heart sound. So, of course, we have the markers, right? Aortic on the second intercostal space on the right. Then you go to the second on the left, pulmonic, third, Erb's point, fourth, tricuspid, and then fifth, mitral valve. So second right, second left, third, fourth, fifth. And then you'll look at, is it S1, S2, which is a love dub sound, right? And then a 3 would be like a gallop, and then 4, S4, I forgot that one. Or a murmur, which would be an abnormal heartbeat with like maybe like an extra sound, but it's an inconsistent beat. You look for edema. So edema generally starts at the extremities, which will be like the ankles, and also you palpate that, see if it does the skin bounce back or does it stay. We call it pitting edema. See if it's bilateral or is it just one side. And it, like I said, it starts at the ankles but go all the way up the legs. Sometimes you can have arms edema. You can have edema, perineal edema. Sometimes edema could be positional, so when people's legs are down and then you elevate them, the edema can resolve. So be sure to note that, and then also grade the edema if it's +1, +2, +3, +4, and then if it's pitting or not pitting. JVD is generally when they're sitting up. They can turn their head to the side. If this jugular vein is distended, it'll be like tight like a rope. It'll pop up from their throat and it'll be apparent. Sometimes you don't even have to have them positional, you can just see it. Also, you'll ask about chest pain. Is it tightness or feel like an elephant sitting on their chest? Palpitations, like an abnormal heart racing, feeling shortness of breath or fatigue with exertion, and then sometimes at rest can signify a congestive heart failure. So that's kind of like a brief overview of the cardiac assessment and how they kind of ties together with possible disorders.